Hello, I'm Dr. Brian Nardi with Nardi Family Chiropractic, and today we're going to be talking about chiropractic care for infants. Let's answer one question that's very common among parents is, well, why would my infant need to be adjusted? They're this perfect little baby. They haven't experienced life like we have. How could their spine possibly be out of alignment? Or why would they be experiencing some level of pain to need to be adjusted? Let's consider the birth process itself. When being pushed through that birth process, their skull crowns in order for the baby to be born. That pinches down on the atlas bone at the top of the neck, which can then subluxate or misalign that bone. When that occurs, it interferes with the brainstem. And that's important because the brainstem houses vital functions like breathing and digestion and sleep. Mothers are often told that their child can have a low APGAR score or maybe even a failure to thrive is a new buzzword. Oftentimes we have mothers bring their infants in because the child doesn't nurse or they're colicky or they're regurgitating after they do feed. All of these problems can be traced back to an atlas subluxation here at the top of the neck, interfering with the brainstem. Oftentimes we adjust that infant. Mom will come into the exam room, sit down, close the door, and the infant will start to nurse right away. That often occurs even when mom has been told that their child can't nurse or that they can't nurse because of the reflexes that filter through the brainstem. And that simple adjustment to the atlas clears it all out. Baby latches on right away. So let's answer obvious question number 2. Well, what does it take to adjust an infant? Well, all it takes is the pressure that we are using right now to determine the ripeness and firmness of this tomato. In other words, it doesn't take any pressure at all. Another way to look at it is that snap is more pressure than is required to adjust an infant. I tell you, there's nothing better, and there is no better feeling than when a mom or a dad comes up to us and hands us their child. We rest them on our shoulder, we check them, give them that gentle adjustment, and their colic goes away, or again, mom comes in and is able to nurse their infant the way nature intends it for. So the best advice that I can give you and urge you is to have your infant checked and adjusted if needed as soon after their birth as possible. You know, most pediatricians aren't trained to detect a subluxation in their neck. And parents can often go months working through a colicky child. So getting them adjusted is going to save you time, get you sleep. It's also going to save you money on formula and time preparing that and continuing to go to the doctor. So get your infant checked as soon after the birth as possible. We've been invited into the birthing rooms after babies have been born, and we can do that for you as well. We can talk more about this at your next adjustment. Thank you, Dr. Brian Nardi with Nardi Family Chiropractic. Have yourself a happy, healthy day.